Welcome July 11th to the Health Wrap. And I think the headline is we're in a free fall. I think that's what I heard this morning, a free fall here in the United States with COVID-19, Carla.
Hi, Carolyn, and welcome everybody. Across the country, patients are just pouring into hospitals. And we talked about this last week. We talked about the hot states in Florida, Arizona, California, Texas, and they continue to set records daily. And I was just telling you, just in California, 7,700 new cases on Thursday, according to the state health department. And now California has over 300,000 cases of people who have been confirmed to have COVID-19 and about 6,800 deaths. It is like blazing across the country.
This is very frustrating. And for those of us who like to find solutions, we've been talking now for 12, 13 weeks trying to give people some advice on what to do, and there is no cure, there is no vaccination yet, and so all that we have at this point is the face mask, the social distancing, and really and truly, if you can afford to stay home, stay home. I mean, if I hear about another COVID party, I'm like, who goes to these parties? Who is that person?
Absolutely.
I mean, we've got to be smart about this, people.
Yes, and I was saw this morning, just this morning. Los Angeles Apparel Factory ordered closed after over 300 coronavirus cases and 4 deaths. And it's my understanding that this plant had closed before and reopened, but the county public health officials, they said, you can't close and reopen and hire new people. And they had told them you need to have everyone tested when they come in. So people need to realize that the CDC says that 60% of Americans have some type of underlying health condition. And it's my understanding that this plant is in South Los Angeles. So we know that the type of people, underserved people in the community, that doesn't mean that necessarily everybody there lives in that community, but I bet a large majority of people who are in that underserved community work there.
This week, a lot of people were shocked to hear the news out of Atlanta Mayor Keisha Lance Bottoms and her husband, Derek, and then one of their children. Derek and I actually went to high school together, and I sent him a quick text and offered prayers for the family because we really are hoping that this is something that they can beat and they won't have a problem. What's interesting about it, though, is you heard people on social media saying, well, she ain't got no symptoms. She doesn't have no symptoms. How many times have we told people, you can be asymptomatic? You can be walking perfectly fine. And what she said is what alarmed them or alerted them is that I guess last week, Derek was actually asleep from Thursday to Sunday. And they thought that was just highly unusual and a little bit of extreme. And so that triggered them to get tested. And so it's been a scary time. I know she's been under a lot of pressure and he's been trying to be supportive and navigate this. I mean, it's a tough time for everybody. I know she made a decision to sign an executive order to basically say, if you go into Atlanta, you better pack a mask. They're serious.
And actually, she signed an order that going back to phase 1. So that means that you won't be going into restaurants, sitting around, and basically you have to be an essential worker, so someone who has to be at work to be out. And the other thing that's going on there too, they are now saying that MARTA, which is the rail system and the bus system, the transportation system for Atlanta, they're going to require that you wear a mask.
I just, I guess my level of frustration is, why did we just say this from the very beginning? But you remember Dr. Hildreth warned us when we talked about this, and he said, if people are doing this at different stages and at different levels, we're going to find ourselves going back. And that's exactly what we're doing. Atlanta's not the only one going back to 1. A lot of people are going back to 1. Bars are now putting signs up saying, oh, we'll be back soon. We'll be coming back soon. Here in Charleston, over at the Medical University of South Carolina, they actually came up with a new charting system that shows you what level we are at particular times, because we're not out of the woods by no means. Red, obviously, we need to be gravely concerned, and then you've got code orange and yellow and green. It's just an attempt to simplify the process of reporting where we are. But we're like you guys in Tennessee. We ain't got nothing to brag about, nothing to be proud about. We still have work to do, people, in terms of really taking this seriously.
Well, we had yesterday an additional in the state of Tennessee, 1,900 cases. That's a lot. So this is why we're seeing states taking a step back. But some of this can be prevented, as we've said, with masks. And that's Dr. Hildreth there with me when we were doing our public service announcements. And these are some tips from him, from Meharry, the president and CEO of Meharry. He's been in infectious disease for 40 years. Cotton is the preferred material. Be sure not to flip it inside out, as that can put the contaminated side to your mouth. And I saw someone do that, and I told them, I said, that's why you have it on, because when the contamination, the infection comes, you don't want to flip it over and put it dead in your mouth, down your throat. Wash the mask after every use. The best way to wash it is in the washing machine. I will tell you that I wash mine with antibacteria types of liquids or soaps, and I do it sometimes in the washing machine, sometimes by hand, but I always use antibacteria. When the material begins to look frayed, it's likely time to replace it.
Absolutely. Again, it helps to have one. I don't know about everyone else, but I tend to move a lot, and so I keep them in all different points in the house. One at the door in case somebody comes to the door. I put another one in another part of the house if I'm going outside. So again, have them readily available. Right now, as long as we have no vaccination, the mask, the social distancing, those are going to be the things, and the testing, and we'll talk obviously a little bit more about that as well. But those are the things that folks can offer. Don't forget washing the hands and just the general sanitation and in terms of keeping things clean. This feels like a free fall because we're going, not just back down at the same time, and no one wanted to be here. And it's not like we didn't have any advice. Okay, I feel like I'm lecturing. I don't want to lecture. We do have some messages. We want to get to the messages, and then we'll come back because we've got Dr. Sherry with us, and we started talking last week about kids going back to school and was it safe, and what administrators were going to do. And now we're finding that there's a whole level of anxiety the parents are having about sending their kids back.
Absolutely. And this is one of the facts. According to the Washington Post, the World Health Organization updated information. Now, this is very important. That coronavirus may linger in the air, particularly in indoor settings with poor ventilation. Poor ventilation, meaning you're in a room like a church with a lot of people, one of these parties, even a work setting, and you do not have very good ventilation, that this virus can linger. So we're looking at a 7-day average of 52,000 people. And that means cases on average are 7,100 cases up from last week. So this is just an average that they had in the Washington Post. So this is why we keep saying, wear your mask, continue to social distance, and wash your hands. It sounds like a broken record, but guess what? Wouldn't you rather wear a mask instead of a ventilator?
Stay home if you can. Well, you can't even offer the ventilators. Mississippi this morning was reporting they have no more ICU beds. Okay, so what does that mean? It means you're having trouble breathing. You try to go to a hospital in Mississippi and you can't get in because there's no bed for you. So the ventilator option is not necessarily a viable option to even entertain, because the PPE problem that we saw 2 months ago, people, we saw it in New York, we saw it in the other Northeast cities. It's now down south and out west. We're going to come right back in a few minutes and talk to Dr. Sherry. We got a message though. Stay tuned.
Hey, what up, man? It's your boy 615 Exclusive. As you can see, we out here giving away plants. That way the kids and the people can grow their own food and eat their own food. Make sure y'all mask up out there and stay safe, and check out my music, Missing Me, and all my other music on all platforms. 615 Exclusive.
To help protect others from COVID-19, DHEC encourages everyone to wear a mask or cloth face covering when in public. Make sure your mask covers your nose and mouth, and you can breathe through it. Remember to clean your hands before and after putting on your mask, and try not to touch the mask or your face while wearing it. Don't use a mask on children under the age of 2, and don't use surgical masks needed by healthcare workers. Help stop the spread. Visit scdhec.gov/COVID-19.
Welcome back. Is that a new fan we have of the Health Watch?
That's our fan. That's our professional fan. Mrs. Walker, Benita Walker, First Lady, Faith
About to
United.
drop a. Oh no, hello, Ms. Walker, but I was also trying. There's Fred. Hey, Fred. We're not related. Fred has an extra S. I just had one S, but Fred has an extra S. So great to see him. Also, nice to see Carlette.
There's Miss Carlette, who is a nurse in Seattle, my sister-in-law. Mm-hmm.
Yeah, happy to have him on board. But the rapper, you met a rapper this.
Oh, yes. So let me tell you about 615. So I was out with Farmer Reggie, and I went back to Napier to the public housing community. And next week oh my goodness, next week I'm going to have an update. But I was out there and I saw the young people saying, did you see 615? Did you see? I was like, okay, the area code in Nashville is 615. Did you see? And then I saw these people gravitating toward him. And I went over to him and he was like, oh man, thanks for coming out here. And I asked him, hey, can you do a little message for us? You know, you're out here helping out and you've got a mask and everything. And he did it. So he is a artist 615 exclusive.
Well, honey, I'm a new fan of 615. He had that mask. But that's my man. That's my man. So happy to see the kids still learning while they're in quarantine, because the question of going back to school has become a real serious one. We last week talked to South Carolina's Teacher of the Year, as well as one of the school board members here in Richland County, the home seat, the capital. But that questioning of taking or sending your kids back is high stressed. It's a high stressed question.
Absolutely. And parents are facing to make decisions about camps, about school. Parents are returning to work. And, you know, it's like, what do you do? How do you know what to do? You know, Carolyn, I was talking to you about some camps that I had seen stories about, and it's unbelievable. And it seems like it's always about 80, 85, or 90 kids. Well, in Missouri, there's a sleepaway camp that's closed after 82 kids and staff got COVID-19. And that story was everywhere. That happens to be from the New York Post. In Georgia, Public Health Department had about 85 positive cases connected to Lake Burton there at a camp in Rabun County, and that's North Georgia. So parents are still sending their kids to camp, but I think a lot of these camps now are probably taking a second look. And in addition to camp, people are concerned about, and that's when I say people, I'm talking about parents and teachers and service workers who, you know, we've got the bus drivers, everybody is concerned about going back to school. This is the Health Wrap with Doctors on Call, and we have a doctor today, Dr. Sherry Blake, a clinical psychologist from Atlanta, is joining us. Good morning, Dr. Blake.
Hello, Dr.
Good morning. Thanks so much for having me.
Thanks for being with us.
Thank you for getting up and being part of the Health Wrap. I guess the first thing, being that you're a clinical psychologist, I want to know what, you know, you're talking to parents, you hear parents that are stressed out and they're vacillating between, do I let my kids go to school? Do I homeschool? There's a lot of pressure on people right now as we return to school. And a lot of schools are opening up in August and they're going in school, and then some are doing distance learning.
There's pressure everywhere. And I mean real pressure, because the anxiety is now just sharply increasing. The idea of putting your child on a bus, the idea of a teacher being in a room with 30 kids, it's real. And we know with children, I don't care how much we say, wear your mask, it's going to be very hard to have children wear a mask all day. That's really, you know, you have to ask yourself, is that reasonable when you can't even get them to wear it when you're out? So if you can't get them to wear it when you're out, what do you think they're going to do when they're in school with their friends? Also, there's a tendency for people not to wear masks around people they know. So you have kids around their friends, is highly unlikely that they're going to keep that mask on. And so we have a real increase, a real problem in terms of the idea of going back to school, because we're just not prepared. And as a parent, I can understand the anxiety. I can understand the anxiety as teachers. I mean, this is real. And I would, you know, people say, well, they can't get behind. I would rather have them behind than to be in an ICU unit or to be dead. And one of the things we're not talking about, we're so worried about people catching the virus and possibly passing. We don't think about catching the virus, surviving, but having all the side effects. You know, we have lung damage. We have all types of things that linger that someone's got to take care of these people. So this is a real issue. And I definitely am concerned, especially when we see what's happening in camps. We see what's happening in the world. And my thing is, until they open the Capitol for visitors and they open the State House and the music, if they can't open those settings, what makes you think they can open a setting where you're going to be asked to be still or to be in a confined room for 4, 5, 6 hours a day? No.
I think they did reopen the legislature, the Capitol in Mississippi, and a whole bunch of them got sick. And so
Right.
now they shut it down and we're going backwards. So what would you tell parents to do? How would you handle this family? What would you tell them? How would you tell them to approach it and talk to the kids about it? What's the best way to deal with it?
I think, first of all, as a parent, and thank God I'm an empty nester, so I'm not making that decision. But the reality is, I would tell parents to do what's in their best interest, be honest with themselves, and they have to look at the data. Don't listen to the hype. Don't listen to just all. Look at the scientific data. What are my chances? What do they have in place in terms of safety? And as a parent, you have to do what's best for your family. And if that means homeschooling, if that means doing some online stuff, yeah, it may be inconvenient, but would you rather be inconvenient now than to be sorry later?
So what is the language that you use with children? Everybody says, tell them to stay calm. What rationale do you give them? Because they watch the news, they hear people talk, and they're watching and seeing everything we're seeing, even the young little kindergartner. What language do you tell them if they are going to, even if they're going to be homeschooled, because they need to know, this is what's going to happen. Mom's going to have to do the work. Dad's going to have to do their work too at home. How do you set up the scenario if they're going into a building or even if they're staying at home?
Well, first of all, it's hard to expect them to stay calm when their parents are really stressing out. In order for a child to be calm, they have to see calmness. So you also have to limit the TV. You have to limit some things, but you have to have an honest conversation with them. Have an honest conversation and talk about why you're here, why we're staying in, why, where we are. We were hoping by this time in August, everybody would be, but right now that's not true. So what we need to do is we have to protect one another. I want you to protect yourself, but also want to protect you. So if we choose to stay home to doing homeschooling, we need some rules. Like you have rules in school, you have to have some rules at home. One of the rules is we're going to get up at a certain time. You're going to work on schoolwork from this time. Get a schedule. Get some real structure within your home. A lot of parents have to work at home. That's not an option. If you're working at home, have the children working when you do. Have breaks. I'd also say talk to other families that you are close to and see if you all can develop a network, because you can develop a social support network. If your kids are the same age, maybe, if you're good at math, on this day, I will do the math for all the kids. This will give you a break. I will do the reading on this day. Have parents to be a part of that, or even hire a teacher to teach in a small pod, because that too will give the social interaction, but they won't feel alone. Another thing, a lot of times we can go out to nature, we can learn science, we can learn math and learn things in different ways. So if you have a small group and those parents are practicing safety like you are, they've all been tested, everybody, then get a small group together and do some things that you can do independently.
All right. Well, thank you, Dr. Sherry Blake, clinical psychologist, Atlanta. And you say stay safe. And thank you for joining us on the Health Wrap.
Thank you. And the last thing I want to say is, remember, you're not alone. So you're not in this by yourself. Reach out for help if you get too stressed. Don't hesitate. Thank you so much.
Take care of yourself.
Take care. Bye-bye.
So very true, Carla, in terms of reaching out and saying when you need help, or just saying, this was my week where I had to just say, ladies, I have to catch up with you later.
Yeah.
Got going on, and you just kind of have to step back and navigate through all the challenges, because it is challenging. I mean, we don't have small kids. We have situations where we live with our parents, and so living with my mother and my father, it has its challenges sometimes, and I even control the TV. They're getting all the bad news up in here. My mother's like, well, explain this to me, or how did that happen? I'm like, no, we're not doing all the bad news up in here this week, okay? We're going to get through this. It is continuing to be challenging for all folks, but I think certainly in our cases, that's part of the reason we have to be extra careful, because we're living with folks who are in that class of individuals age-wise. But hey, the number has gone down. They're now looking at folks under 35. And in Miami, I believe it is, they had a brother and sister. Sad story. Brother and sister passed away 11 days between each other. So this isn't over, y'all. It ain't over. It ain't over.
It's not. So we will be back right after this.
South Carolinians are asking, what can they do to stop the spread of COVID-19? Our response? Answer the call. Through what's called contact tracing, DHEC's trained contact tracers call everyone who has tested positive for COVID-19 and those who could have been exposed. All information is confidential, voluntary, and collected over the phone. This information helps us protect you, your loved ones, and your community. Answer the call to keep your community safe. Visit scdhec.gov/COVID-19.
Contact tracing, we've talked a little bit about that. We're going to talk some more. I just learned, a friend of mine just got certified, but a lot of people are trying to understand, what does that mean, particularly since more folks are getting tested. So you want to stay tuned, is all I'm saying, to the health wrap, so that you can learn more about what the contact tracing will actually involve.
Okay. So Carolyn, you know how I love different types of cuisine, and I haven't been able to enjoy, and like a lot of people at home, their favorite restaurant because of the pandemic. And we're all eating different food, and we're looking for different ways to cut calories as we enjoy comfort food. Well, I've pulled out an oldie but a goodie, and one of my favorite videos from a while back with celebrity chef Ross James. So we're going to show you how to remix a pot pie.
I got tons of vintage recipes for my family. I can't wait to get my hands into them, take the old and make them all new.
Savory chicken pot pie like your mama used to make, and just thinking about it, you just get tantalizing taste buds. But Chef Roz, you're going to give this old school dish a new twist.
Yeah, we're going to remix the pie. We're going to upgrade it with seafood. All right, what we're going to do is we're going to start with the carrots first.
Alrighty.
And we're going to add a little bit of grapeseed oil to coat them.
What else is in here with the carrots?
So these are heirloom carrots, and so that's...
What does that mean?
They're, it's like a vintage carrot, so it's like how they used to be. So it's multicolored. So I like the whole color, because you eat with your eyes first, so I'm all about the color, so I'm always looking for the visual. Okay. So then add just a little bit of salt and pepper.
Just a touch. Okay, just to add a little flavor to it.
And just a little bit of dill.
I love dill, and it just smells. You know what? I used to grow this.
Dill is perfect.
Oh my gosh, I love it.
Dill is perfect with seafood. So then we're just gonna just put them on the sheet pan.
Okay.
Can't get any simple than this.
Just pour it on here.
Yep. And just do a nice thin layer. And then we're going to pop those into the oven, the carrots and the potatoes.
That's going to add to the color.
Absolutely. So this pie is going to be beautiful inside and out.
Okay. Now these are potatoes, different colored potatoes.
Absolutely. So what I'm going to do, I'm going to hold this up while you do that.
Okay.
And then you go ahead and mix that and do the exact same thing with the potatoes as you did with the carrots. And we're going to roast these to get them nice and tender before we put them in the pie.
Okay.
So we're going to cook this until it gets soft. So now our vegetables are soft. So we're going to add our flour. And the flour is a thickening agent for this. And what we're going to do is soften it up put it in here with the butter.
Kind of like a roux.
Yeah, exactly. It's exactly what it is. So once it gets all incorporated, we're going to add our fish stock.
Fish stock. Okay, so before, in the old days, we used to do chicken broth. Mm-hmm. So fish stock. How do you get fish stock?
Well, what I did is actually, this is more of a shrimp stock, because what I did is I bought the shrimp in the shell, peeled it, and then used the shells. You boil the shells with your onion and celery, just like you're making a regular stock. and then you strain it, and then you
So
have
that gives
this.
you the flavor.
Yeah,
Okay.
so that way our pie has the seafood flavor all the way through. And what we're going to do is we're going to cook this until it gets a little thick, and then we're
Okay.
going to cool it off in the refrigerator.
Okay. Okay, so we've got the vegetables out.
Okay, so what we did was we did like a cup of each of the vegetables to go into here, and then we also, of course, we had the celery already.
They look good and roasted, don't they?
So what we do is we cool down the filling part, and what we're going to do is add the vegetables to it.
Okay.
So we're going to add the carrots and the potatoes.
Okay.
We have our shrimp. We have Alaskan king crab legs in there. We have scallops. And we have lobster tails. And that's a pound of seafood that's going in here. Once you crack open the crust and you see this, it's time to get down.
Oh,
Time
my
to eat.
goodness.
Time to get your
It's
grub
time
on. Yes. Time to get your grub on.
Oh,
This is what they used to do with the chicken pot. You know, we've got to upgrade. So we're upgrading it in style.
Okay.
Is we're going to fill these up.
so why do I feel like I'm in the kitchen in New Orleans?
So I want to cover it so that it'll cook, but the top still stays moist. I don't want to dry it out.
Okay.
So let's put these in the oven.
Okay.
Since we're doing the remix, we updated the tools as well. This is my favorite new tool, Carla.
What is this?
This is a lattice pie cutter. Put your hand at the top.
Right here.
Yeah. And
Okay.
then you're going to just roll down. Press and roll down.
Press and roll.
And I'm not going to do it exactly fast.
Oh.
So once you spread it out, all we got to do is cut it. So we just pop these in the oven.
Okay.
Toast them, and they're ready to go on top of our pie.
The piping hot seafood pot pie is out of the oven.
Yes, it is. Doesn't it look amazing? And so all we have to do now is top it with the crust.
Now this is a whole new look for an old time favorite. With the
remixed
seafood,
it.
we remixed.
Let me know.
Ah, now give me some of this.
Absolutely.
Now, you know what I was going to say? My only problem with pot pies is that they're usually too small, but I love how she made them bigger.
Yeah. And that you don't have all of that fat with, we like crust, but she said we're going to get rid of that crust because that adds to a lot of fat versus you're eating vegetables and seafood. And you can use any type of seafood. She just decided to mix it all up. But it was delicious. I think I'm going to make one for tomorrow.
All right, now, Miss Kyla's cooking. I'm ordering cookbooks. Miss Kyla's cooking.
Miss Monique said she needs the gadgets.
I hear you. Like I said, I ordered the cookbook, the vegan cookbook. Let's see where that gets me. The reason that we talk about food, particularly on this show, is because we know that when we talk about health disparities, one of them is, in fact, closely related to the obesity factor and the weight that folks might carry and how they will respond to this disease. So, it is, everything here is with a purpose, and that's why we talk about this as we talk about different segments in cooking healthy. This next story is, I don't know about ice cream, how healthy it is, but you scream, I scream, we all scream for ice cream, right?
Hey, good afternoon, ma'am. My name is Officer Warner with Halifax Police Department. Are you aware of why I pulled you over today?
No.
Are you,
no, sir.
Are you familiar with vehicle code 1739? Well, it's actually against the law to drive on a hot day without an ice cream cone. So,
Oh my God, I was nice.
on behalf of the Halifax Police Department, we're just making sure that everybody's following all the laws today and are driving with ice cream cones. Like I said, I'm Officer Warner. This is Chief of Police Lance here in Halifax, and we just wanted to make sure you guys were in compliance.
Y'all have a wonderful day.
Are you okay?
Oh my God.
Well, you guys have a great day.
Y'all too.
Have a good day.
Thank you.
Have a good day, brother.
That's the kind of stop you want to get, right?
Yes.
Against the law to drive without an ice cream cone on a hot day.
And just like the other story you saw with the cooking and with this, that popped up in my rotation. So it was done before the pandemic, but that was in Halifax, Virginia. That I just couldn't stop laughing at that. That was so funny. Hey, Lisa.
Hey, Lisa. We think it's cool. I'm getting ready to go get me some ice cream. We're out of time, but guess what? We'll be back again next week. Lots of exciting things happening behind the scenes as we are delivering our Docs on Call initiative, and specifically this show, The Health Watch. So you want to stay tuned. You don't want to miss anything. Have a great week, everybody, and stay safe.
And don't forget to mask up.